All right. Good morning, good afternoon to everyone joining us today for this webinar. Thank you for joining NSC for this presentation on creating an opioid overdose response program. This is a really relevant discussion today. It's our third week of National Safety Month, and this week is focusing on risk reduction. My name is Claire Bryant. I'm a Senior Program Manager for our Workplace Wellbeing Initiative here at NSC, and I will be your moderator for this session. I've got a quick couple of housekeeping notes before we proceed into the speaker introductions. Firstly, the chat feature is not available to attendees, so please use the Q&A feature at the bottom of the screen to submit questions to our speakers. We'll be taking most of those at the end of the presentation, so definitely add those in as questions come up. As always, it's important to note the recording will be emailed to all registrants following the event. And then lastly here, as a reminder, National Safety Month continues through the end of the month. So with both publicly available and vendor-exclusive content, there's plenty of resources for you to take advantage of. You can learn more at nsc.org/NSM. Today, we'll get to hear first from Janice Hartgens regarding some background of the overdose crisis in the workplace, and she'll also review some actionable resources NSC has made available to address this risk. Janice is a registered nurse executive with over 30 years of management and leadership experience in both the hospital environment and the transportation industry. Since joining the council, Janice has taken over the responsibility of leading the effort to get naloxone into every workplace in America. Prior to joining NSC, Janice was retired after working 30 years for UPS. We will then hear from Jonathan Hung as he describes his steps his organization has taken to make naloxone available and to improve their overdose response efforts overall. Jonathan Hung is a senior EHS director for Moxie and Power. He was formerly an auto worker at the NUMMI in Fremont, California. His professional journey spans over 16 years, during which he's worked with industry giants such as Toyota, Oracle, Tesla, Waymo, and Astra. These experiences have enriched his understanding and expertise in these sectors. In his spare time, he enjoys studying astrophysics and building race cars. All right, Janice, I'm going to go ahead and turn it over to you to start this dialogue today.
Thank you, Claire. And I'm so happy to be able to be with you today and present on this topic. If we go to the next slide, please. Our agenda, we're going to talk a little bit about the background of overdose crisis in the workplace and the workplace impact, steps to create an opioid overdose response program, and NSC resources, case study with Mox and Power with Jonathan, and then Q&A with Jonathan. Next slide, please. So just as a refresher, in case we have some people that are new to NSC, NSC was founded in 1913 after the Triangle Shirtwaist Factory fire. And some of you may have heard of this fire in history, but it was in New York City, and back then there were no regulations regarding locking doors and exits and so forth in the workplace. This was a short fire that took a heavy toll on women and children and loss of lives. So from that, the NSC was born. So out of the ashes of the Triangle Shirtwaist Factory, the NSC was born to impact both workplace and roadway safety. With over 13,000 members, covering 41,000 workplaces, work sites. And we really want to eliminate the leading causes of preventable deaths so people can live their fullest lives. And so we focus these efforts in the workplace and on the roadway. And we like to say we can save a life from the workplace to any place. Next slide, please. So this slide is a slide that NSC did some research back in 2022 during the pandemic. And this information was really built around COVID-19. But it shows that trust in institutions, meaning, they looked at employers, CDC, local government, and the federal government. And as you can see, employers by far outweighed everyone else as far as trustworthiness. So I tend to think of what we're doing with Respond Ready Workplace and what we're doing to try to get employers to adopt this message of having this life-saving medication in the workplace and training employees in the same way that we addressed COVID. by saying that we are trying to protect each other. We're going to save lives and we're going to protect each other. So next slide, please. This slide is a study that was done some time ago, but it shows the impact of employers. When employers decided to make smoke-free workplaces and really took that on, we saw a reduction in smoking overall. The elimination of secondhand smoke, the changes in overall health and well-being of employers. People started quitting smoking. And so the impact of employers that they had on changing behaviors in the workplace around smoking is indicative of what the impact and the actual I guess the actual trust again that employees have in employers when it comes to health and wellness information. Next slide, please. So at NSC, as I hope everyone knows or will come to know, we follow the data. We look at the data to tell us where we need to be focusing and what issues are arising in workplace and in our workplaces and on the roadways. And so we use injury facts to follow this data. And what the data is telling us now, we'll see on the next slide, that overdoses are a workplace issue. I've been with NSC, as Claire said, I've been with NSC since July of 2023 and really started working on the awareness around overdoses in the workplace and having employers understand that this is a workplace issue. And as you can see, in the last decade, a little over a decade, unintentional overdoses in the workplace has risen over 600%. And overdoses account for nearly 10% of all deaths in the workplace. So no matter what the reason for the death in the workplace, almost 10% are overdose related. So this is a workplace issue. And this is why we are so focused on getting employers to adopt a naloxone program in the workplace. Next slide, please. So when you think of preventable deaths and things that ways that you can control deaths, usually you think of like skin cancer and hypertension and cardiac disease and things that you can do to prevent those deaths. But the preventable death ranking here is showing that poisonings, which overdoses falls into the category of poisoning, are outpacing motor vehicle crashes. So we have a lot to do now when we see that poisonings are outpacing motor vehicle crashes as preventable deaths. So we need to focus on poisonings in our workplaces, and overdoses are poisonings. Next slide. Everyone's impacted. As we've talked to employers and they've said, well, it's not happening at my workplace. I don't see this happening. Everyone is impacted. You may not see or have employees that are experiencing unintentional overdoses in the workplace that you can actually see, but everyone's impacted. As you can see on this slide, and I want you to pay attention to the fact that between the ages of 24 and 64, our working age adults are being impacted by overdose deaths. And this is a death rate by ethnicity and age. So this is not just workplace data. This is what's happening in the US. So we really need to understand that our working aged adults are being impacted by overdose. Next slide, please. So this slide talks about injury rates in some highly impacted industries, transportation, manufacturing, and construction. And as you can see, pretty much over the last decade or so, the injury rates have been decreasing, a slight uptick there, you can see in 2020, but the injury rates have been coming down in these industries. If you look at the next slide, though, one back, yep. If you look at this slide, in these most affected workplaces, overdoses are skyrocketing. They are going up. As injury rates come down, overdoses are still going up. These are in industries that are impacted by MSDs, musculoskeletal disorders. So the injuries are happening in these industries. Opioids are being prescribed in these industries, and that can lead to a substance use disorder. So it's really, really important to understand the impact of that overdoses are having in these industries. But again, it is impacting industries across the spectrum, people, lives, ethnic groups across the spectrum. So, but these are the most impacted workplaces that we see following the data. Next slide, please. Thank you. So workplace substance use and misuse. As you can see, as I just said, 66% of the people with a substance use disorder are in the workplace. And so we need to make sure we really focus on the fact that these are our workers. 89% of employers are concerned about the impact of opioids on their organization. So we know that employers know that this is happening. They're concerned about the impact to the organization. And now we need to get to the next step of adoption, to having the opioid reversal medications in the workplace. 9 million people misused opioids in 2022, and 1 in 12 workers has an untreated substance use disorder. So these numbers are impactful to our workplace. Other impacts, if you go to the next slide, we talk about, I like to say what the workplace is a microcosm of society. Whatever is happening outside of the fence line of your organization is happening inside your organization. And overdose deaths are just the tip of the iceberg. And as you can see on the slide, there's so many other things socially that are happening, as well as within your organization, that are happening as a result of substance use disorders and having overdose deaths within your workplace. So really, when we look at it, it really begs and behooves us to really peel back the layers and see what else is being impacted by not having proper mechanisms in place when it comes to substance use disorders and overdoses in the workplace. If you go to the next slide. NSC has our cost calculators, and I hope that you've been able to use the cost calculator. But this is just an example of a small company that we chose in the construction industry to really show the impact of workplace substance use disorders. And this is a case where this example employer would incur over $150,000 in costs related to substance use disorder. And as you can see, in the United States, it's over $1 trillion worth of cost as far as the fatal opioid overdoses and the cost to the US. And then employers can save an average of $8,500 for supporting these programs within the organization. So there are ways to show the cost benefit of having these programs in place within an organization. Next slide, please. So when we look at this year, we did an employer-employee survey, which some of the results are here, and the entire survey will be coming out and available in the next couple of weeks. But we wanted to kind of just give you a snippet of some of the responses that we were able to get from the survey. And 2/3 of the employees have been impacted by a substance use disorder. So we talked about the fact that 66% of people with a substance use disorder are working. 2/3 of the employees that we surveyed talked about that they have been impacted some way by substance use disorder. So it may have been themselves, it may be a family member, a significant other, etc. Half of the employers indicate that the organization is already stocking naloxone in their work sites. So they say that they have it, but only 28% say that they are fully stocked. So they may have it in one location and not another. But so we really need to increase the saturation of having naloxone in the workplace in quantities that can really impact, and employees are trained and know where to find the naloxone. And then only 42% of employers are aware of recovery-ready, recovery-friendly workplaces. And as we'll talk about later, you know, the naloxone piece is a tactical piece, and there are so many other things that employers can do to really make this a 360-degree view of this program. And being recovery friendly and recovery ready is a piece of that. And you can see employers are not there yet as far as that's concerned. The next slide we'll talk about is stigma. I think we all know that the stigma that's associated with substance use disorder, and it's really something that we have talked to employers about, and we really need to address as we move forward in really impacting this opioid crisis. That we need to bring this into focus, substance use, mental health, and really address the stigma associated, because this will allow the employees to be able to talk to their employer and really be able to get the help and have the success in recovery if they have those opportunities. And we really look inward at how we feel about and the stigma that's there. So stigma is something that we really have been talking about and addressing as we continue to bring awareness to our program. So next, we're going to talk a little bit about the Respond Ready Workplace Program. And Respond Ready Workplace Program is built on 3 pillars. We really try to keep it simple: awareness, access, and adoption. And by doing this, we're going to reduce death rates in work sites by raising awareness, getting people to understand substance use disorder, to understand and recognize stigma, and really address the fact that unintentional overdoses are happening in the workplace, and that this is a workplace issue, and employers should look to adopt a program. The next is access. You know, naloxone has only been available over the counter for a year now. Last March, the FDA approved it for over-the-counter use, and it started shipping in October. So we're coming up on a year of actual over-the-counter access for naloxone. And NSC has partnered with Emergent Biosolutions, the maker of Narcan, to be able to help employers access naloxone and not have a barrier of not being able to find a partner to get the naloxone into the workplace. And then adoption. It's so important to train employees on how to administer naloxone, have the naloxone in place, because as we train, the more employees that we train to be able to save a life, they will be able to save a life not only at work, but in the community. And I like to say that the employer should be seen as a conduit to the community, because all of the employees that are working within your fence line, again, are members of that community. And if you train them on the administration of naloxone, they'll be able to take that out to the community, purchase their own, and then be able to save a life not only at work, but not only in the workplace, but in the community. Next slide. So a little bit about naloxone. So opioids disrupt the brain's ability to regulate breathing. So most of the time, if you come upon a person that is potentially experiencing an opioid overdose, they're not going to, their breathing is going to be labored, or they may not be breathing. Naloxone will temporarily stop that the opioids from doing this. So it's going to restore breathing. That is what naloxone does. It inhibits, it goes to the brain and impacts those where naloxone, the opioids are connecting into the brain, and it temporarily stops that action, and the people should come back to breathing normally. So that is the purpose. It's over the counter, and so when you think about naloxone, you think about administering naloxone, it is an opioid reversal medication. It will not do any harm to someone who is not experiencing an opioid overdose. So please understand that the main cause, the main thing you want to do when administering naloxone is restore breathing. Get that person breathing again. Next slide. So how can you create an opioid overdose response program in your workplace? Again, we tried to keep these steps as simple and easy for you to be able to implement a program. You want to plan, provide, train, and maintain. So we want to plan out the program, get your stakeholders involved, create your policies, be able to provide naloxone, obtain it. We just talked about getting the naloxone from, through NSC, through our access partnerships, or other places within your state that is providing naloxone. You want to train your employees on how to see the signs of an opioid overdose and how to administer naloxone. And then as with any program, you want to come back and evaluate the program. So let's take a look at some of these steps as we move forward. Next slide. So action plan, we have to have a plan on how we're going to do it. You got to get the buy-in from your organization, set up a work group, look at how the potential for stigma within your work group, within your organization, and look at setting a policy. All of these things help you get ready to implement your plan, to implement your program. Next slide, please. So naloxone policy considerations. These are some things that you can consider, understanding your locations, proper storage, how many doses of naloxone that you need to have in each of the locations, making sure how are you going to get your training done, any workplace procedures that need to be put in place. Are you going to incorporate it into a standing policy, or are you going to create a new policy? How are you going to communicate to everyone associated how this policy is going to be rolled out, and what does it mean to the organization? And then what other benefits support what you're doing? So do you have an EAP in place? Do you have, what are your fair chance policies? Are you a recovery ready workplace? So, and again, making sure that you're keeping your stakeholders, such as legal and HR professionals, involved in how you're building your program. Next slide, please. Provide. So, we talked about how do you get the access? So make sure you refer back to your risk assessment and policies. Again, how many doses do you need in what locations? And then obtain the naloxone for those locations. Next slide. And then here's a QR code up in the right-hand corner for our NSC access. But, how can you get naloxone? And you can get it, again, through our partnership with Emergent Biosolution, but also local harm reduction organization, local pharmacies, drugstore, or maybe your state even has a naloxone distribution program. So really understanding what your state provides also is an opportunity for you to obtain naloxone, and then share this access with your employees. So if the state or pharmacies or local harm reduction is giving away naloxone, share that with the employees, because this is an opportunity for them to be able to get trained and go out into the community, get their own naloxone, and be ready to save a life in the community, as we talked about. Next slide, please. And then storage. So, we want naloxone to be stored in places where employees can access it. It can be in a first aid kit, can be in an AED. A box of Narcan has 2 doses in each box. So those are, you at least need to have a box with those 2 doses. But someone who's experiencing an overdose may need more than those 2 doses. So please take that into consideration. And then storage. So they're above 104 degrees. Naloxone is a mist, is a liquid. So it can evaporate, but some naloxone is better than no naloxone. So you want to make sure that you still try to give it if you know that it's been in a hot area. And then if it's frozen, the naloxone has a plunger. So if the plunger's frozen, you won't be able to dispense, and the liquid's frozen, you won't be able to dispense the naloxone. But you will be able to dispense it once it thaws. So you want to look at these extreme temperatures and make sure that you're taking that into consideration. And now naloxone, Narcan, has an expiration date of every 4 years. So please look at your product labels, but this is an opportunity where it's got a long shelf life that helps when you're talking about implementing a program where you're not going to be replacing naloxone every year. It can almost be in the same cycle that you're changing your pads and your batteries within your AEDs. So it really has a long shelf life, which is great, a great benefit for a program. Next slide, please. And then train. As I said, naloxone is a nasal spray. It's a mist, easily administered. It's important to train employees again on the signs of an overdose and how to administer naloxone and how to activate emergency response for your area. So those are the things that we want to make sure that employees are trained on as you implement your program. And then NSC has a free e-learning. We launched this e-learning in March, and so far we've had over 500 people take this e-learning. This e-learning is unique because it's tailored for the workplace. It's also differentiated because we have hands-only CPR as part of this training. Most naloxone trainings that you will find tell you how to administer the naloxone. Of course, this training tells you how to administer the naloxone, but in an emergency, you may be on the line with the emergency services, and they need to walk you through doing some hands-only CPR. So we've incorporated hands-only CPR. And so it's interactive as well, our NSC e-learning. So I would encourage you all to please use the QR code, go in and take this free e-learning on the administration of naloxone. We also have administration of naloxone in our CPR AED training as well here at NSC. Next slide, please. And then maintain. Of course, it's important to go back and make sure that we're supporting the victim and the bystanders, that we're looking at the data and how we are managing the data related to the program. Are there any changes that need to be incorporated after you've had the program in place in a while? And then again, continue to work on stigma reduction and education as you've implemented your program. Next slide, please. So we've also implemented a implementation guide, and the QR code here is here. And really, the implementation guide is for employers to provide an example of a process to create an overdose response program and connect you with resources that you need to develop the program. So this is really hopefully a plug and play guide so that you can use the portions of it that you need. If you need to have a policy template, it's in there. If you need to look at stakeholders and how to get people involved, sample memos, things like that are in the implementation guide for you to be able to use to set up a program. Next slide, please. Now I'm going to switch gears a little bit here, but we've been talking about our efforts in the Respond Ready workplace program to get employers to adopt having naloxone in the workplace. And now recently, the White House has come out with a White House challenge to do the same. So, you know, the White House challenge to save lives from overdose is a nationwide call to action across the country for stakeholders across all sectors to commit to save lives by increasing training on and access of life-saving opioid overdose reversal medications. So please consider having your organization sign up for the White House Challenge. The NSC has signed up for the White House Challenge, and most recently, Major League Baseball has committed and signed up for the White House Challenge. So please use this link and have your organization sign up for the White House Challenge, because this is an opportunity, again, to save lives. Next slide, please. And then one of the things that employers have talked about is the legal ramifications or the legal impact of having a naloxone program within the workplace. And so all 50 states have Good Samaritan laws and or naloxone access laws, but you really need to ensure and you make sure that what the protection is in your state. So that's very, very important that you look and understand what those protections and what the rules and regulations are in your state. OSHA does not yet have a standard for providing naloxone in the workplace, and the simple administration of naloxone nasal spray does not automatically make a workplace injury or illness recordable. So you really need to look at the entire event and what treatment overall was given to that employee once they left your premises and went for their evaluation at the hospital. So what we've tried to do to help with this is we've created a guide, a tool for employers to look at by state to see what the naloxone considerations are by state. This is an example of Arizona, and you'll notice that there are links embedded in the document so that you can go to your specific state and see what is covered and what the state regulation and what the citation actually says. And then there's some notes for the business. And really, you know, they want to make sure that you keep a record of where you got your naloxone, make sure that you have a protocol in place for employees to understand identifying an overdose, calling for help, and administration and storage of naloxone. So they give you some key guidelines on what you should make sure your program is covering. Next slide, please. And so I talked about naloxone being the tactical piece. It's just one piece of a comprehensive workplace program. And so there's many other things that we talked about: recovery-friendly workplaces, having an EAP in place, fair chance policies. So you really have to look at what pieces of the puzzle your organization has and where you have gaps and what do you need to do in order to put together a comprehensive plan. Next slide, please. And so recovery supportive workplaces, as we talked about in the data, very few workplaces really understand recovery-friendly and recovery-ready workplaces. And so workplaces, workers in recovery average 10% fewer days of unscheduled leave per year. So when you really have someone who is in recovery and dedicated to their recovery, they can become one of your best employees. And 79% of employees agree that they would be more likely to work for an employer that provides resources for substance use. So you're going to get employees, the employees out there, the workers out there really are looking at what are you providing in this area for substance use. So taking a look at where your organization is in this spectrum and on the spectrum of recovery friendly and recovery supportive workplaces is important as part of implementing a program. Next slide. And now available, our Workplace Wellbeing Hub. We've launched our Workplace Wellbeing Hub. And as you can see, it has different sections of the hub: benefits, policies, data collection, and employee training. So when you think about, going into benefits, some of the things that you'll find are examples of topics that include comprehensive coverage for substance use treatment, flexible work schedules, partnerships with HR, key resources and benefits and checklists, so that you can really look at a gap analysis and understand what you need to do. Policies, there's examples of fair chance and second chance policies, flexible work, drug testing, key resources, downloadable policy templates are contained in there. When you think about data collection, there's opportunities for tracking attendance and longevity, healthcare costs, data management guides. There's a lot of information on data collection and how to do that. And then employee training, topics that employees can have conversations with their families about substance misuse, first aid, driving, impairment. There's key resources to the NSC Overdose e-learning. So you'll find our e-learning is in there. So there's a lot of information that is contained in each one of these areas within the Wellbeing Hub, and there's just a lot more. So I encourage you to please go into the hub and look around because the resources are immense. So with that, our next slide is we're going to show a little video. So I'm going to go off camera and we're gonna go into our video.
Several months ago, I was just browsing social media and it came across the Senate hearing featuring this country music artist, Jelly Roll. He was talking about this really staggering statistic that 190 Americans are losing their lives every day to fentanyl. And the metaphor that he was using was talking about, imagine, a 737 plane falling out of the sky every day, and imagine the headlines that would cause. Most of us as working professionals, we kind of sometimes live in a bubble, and so we may not know the impact that this may be having in our communities. So it really inspired me to I need to dig into this a little bit more. What information is out there? How is this impacting us? And then how can we get involved? So really important early on was to partner with the National Safety Council. We started looking at information and starting to get our program put together. And as far as the implementation process goes, it's really making sure that all different departments understand what we're trying to do, what we're trying to accomplish. So really early on, I think it was important to partner with, HR, partner with our workplace and culture team, and then really try to build relationships and try to get them to understand, okay, this is what naloxone is, this is what fentanyl is, this is how we're trying to create this program, and then really try to get their feedback. At the beginning, we partnered with our human resources department. I reached out to our VP of HR, I explained to her what we were trying to accomplish, and she really believed in the program and wanted to provide that executive level support. I reached out to our HR business partners. I asked them for their feedback. How can we make this really successful?
From me and myself, I learned a lot about how important it is to just build relationships with our employees and building that environment where they can have these conversations, and equipping our leaders in our company, so our managers, our supervisors, our team leads, because we do spend more time here than anywhere, so making sure that our employees are having those conversations.
I have a lot of direct experience with people who have overdosed, family members. So I feel that it is 100% necessary for everybody to be informed.
Within our first training session, I had 2 employees come up to me of diverse backgrounds, and they shared their own personal story. So I think at that point, we decided as a company, we really need to get a little bit more involved in the communities around Moxion. And so, one of the early steps that we took is that we connected with a nonprofit that's local to our Bay Area, Contra Costa County Meds Coalition, and then we reached out to them and just, again, doing more fact finding and really trying to ask them for information and, how can we support one another. I think it took us about 2 months. And, a lot of that time was just answering all those questions that a lot of our stakeholders had. Simply purchasing it and putting it in a break area isn't enough. Some employees may see it. If another employee takes it, then no one else is going to see it. So making sure we have flyers. Our team really focused on communication. So we have TV monitors all throughout our facility. And then we rotate slides that talk about Narcan, talk about NSC, talk about first aid, emergency response. We've now incorporated Narcan into our new hire onboarding process so that every employee gets it. So I think it's recognizing that people learn differently and people respond to different types of training tools. So I'm really making sure that you're doing a blanket training and communication plan so that you can reach as many ears as possible.
I do think it is being received well because people are taking them and keeping them in case of emergency.
And I love how our employees feel that they can openly talk about this with us, because that's really important to foster those relationships and continue to build on that and just continue to invite them into these conversations, because that is empowerment. That is, what public health is.
That response from our employees was super powerful. I think them recognizing what it was. I'll tell you a story. A few days ago, we had Narcan deployed in our warehouse, and we had an employee pick it up, and then we had another non-employee come onto our site and they picked it up. And initially, I had this reaction where that's our Narcan for our employees. And so, I wanted to go down a completely different path. But after thinking about it, I realized, that person, even though they're not an employee, they're a member in our community, and they probably have had experiences recently where if they had had Narcan, they may have potentially saved a life. And so that really changed my perspective on how we want to use Narcan and how we want to implement it in our communities. And so the response that I've received has been kind of tremendous. It kind of changed my entire approach.
It's not just for you, it's for the rest of the world. It's for everybody. It's not saying that you have a drug problem in your workforce or in your business. The way the world is today, you never know when you're going to be driving down the street and see somebody potentially laid out having a reaction, and you could be that person that saves them.
So as we get ready to transition and move into our next segment of Q&A with Jonathan Hung. Jonathan, I just like to thank you for taking the time to come and be with us here today, kind of virtually in person, to talk about your program. And so, Claire, when you're ready, we'll turn it over to you and we'll start our Q&A.
Sounds great. Thank you, Janice, and thank you for the robust overview you provided of the overdose crisis and the impact on the workplace. And thank you again to Jonathan for being here with us to just get into some more of the details. I think that video is super powerful to show the overall scope of your program. So I do encourage attendees, if you have further questions for Jonathan, to add those into the Q&A. I see a lot of great questions already, so hopefully we'll be able to address those that are for Janice as well after we have this conversation with Jonathan. So to kick it off, Jonathan, before we dig into the meat of your program and some of the steps that you've taken, if you could just provide a little bit more context for us on what your organization does and your role within your organization.
Yeah, thank you again, Claire and Janice, for having me. My name is Jonathan Hung. I'm the Senior Director of EHS here at Moxie Power. We are a battery energy storage solution system. So another way to think about that is we're basically making generators that are powered by batteries. We provide power to events such as maybe the Super Bowl, Formula One. We're being utilized in a lot of movie sets. So anyone who needs temporary power, we're sort of that energy solution. And I've been with Moxian for about 2 years now.
Awesome. Thanks for that additional context. And so diving right into your opioid overdose response program, what was your first steps? What process did you take to get buy-in for the program? I know in the video you talk a lot about working with HR. I'm sure there were some other barriers with having the conversations within your workplace. So can you just take us through what that process looked like and how you overcame those barriers?
Yeah, I think really early on, it was important to make sure that I connected with my senior leader, who in this case was our chief operating officer. I wanted to make sure I did as much homework as possible, working through the NSC, working with local nonprofits and really just trying to understand, what is it that we're trying to do? And then making sure that we have all those answers in our back pocket so that when we have that FaceTime with that executive leader, we're able to answer all of his or her questions. What are we trying to do? Who receives this benefit? What resources are available? How are we going to communicate this plan? So I think really having all those answers up front and doing our homework really helped get that executive level support.
Awesome. Yeah, preparedness definitely helps in these kinds of environments to make sure, like you said, to have all of your answers, with you, and hopefully the resources that we have on our webpage will be helpful in that. And so I'm curious, in those conversations, when you were preparing answers, what were some of the most commonly asked questions that you were asked about potentially creating this program, and how did you address some of those questions?
Yeah, I think the biggest challenge that many of us as EHS professionals have ultimately is cost. This is a relatively new thing. Many of us didn't budget for this program this year. We budget for many other things. So I think as EHS professionals, we really have to sort of be creative with our budgets and also explain that cost, to the people that hold, the piggy bank within our companies. So having those upfront conversations, really understanding how many are we going to buy? For me as a first timer, I didn't know how many I was going to buy. And then I was trying to figure out okay, how much is it going to cost? What's our replenishment cycle look like? Should we just do a sample buy now and then really see what the reception is? And then maybe we adjust it throughout the year as the program develops. So cost was a major barrier for us, but again, connecting through NSC, having those conversations with finance, with my executive sponsor, really made the entire process really easy.
Awesome. Great to hear that. And I think speaking of cost, this relates to how you actually obtained Narcan, because I believe that's what you were hosting within your organization. So can you take us through what you actually did to obtain naloxone/Narcan? And, if you had to answer further questions about the cost related to the product itself.
Yeah, great question. So, early on, again, I had no idea how much it cost. I had to Google it. And then I ultimately, in the beginning, went through an online retailer. I purchased, 40 units. I received them. And I was looking at it, I was like, oh my goodness, if, people are using this regularly, I'm going to have to be continuously replenishing it. This is going to increase the cost of the program throughout the year. So, that's when sort of I connected with Janice. And Janice has been an amazing ally throughout this entire process and really giving us resources. And she connected us with Emergent, who makes Narcan, and, connecting with them, I had really great conversations with them, almost to a first name basis, really just, really understanding each other and why we're doing this, I think was so engaging to me, not just as a potential customer, but also learning about the overall crisis in general. And so through that relationship, we were able to secure Narcan at a discounted rate, which is enormous. So every dollar helps. And so through that partnership, we were able to purchase Narcan, and we maintain that partnership even today when we're replenishing.
Great. Yeah, I think it's so important to have those one-on-one relationships so you have that stability. And something that's been interesting for us as NSC in trying to help employers to obtain naloxone and understand how to create programs is before it was over the counter, there was a huge barrier with actually getting hands on the product. So we're just excited that it's over the counter and that there's more availability for us to be able to facilitate some of these partnerships so that employers have an easier time of actually getting the medication on site. So great to hear that that's the process that you were able to take, and it was seemingly simple enough to be able to go through the motions there. In addition to having Narcan on site, what are some of the other core pieces of the program that you'd like to share with the audience?
Yeah, I think anytime you develop a program, it's really important to have a communication strategy. I think that's probably been the main primary accelerator for our program, is knowing that employees learn and communicate differently in many different ways. So using whatever available resources that you have within your company, and make sure you're broadly communicating. Because if you just deploy it in your workplace and you don't communicate it, no one's going to know it's there. They might walk by it. They may not know what it is. So making sure you have a really good comprehensive communication plan is really important. So that's where we partnered with HR. We partnered with our workplace and culture teams. We have monitors all throughout our facility. So we made sure that we inserted slides dedicated to Narcan, dedicated to fentanyl, opioid crisis, employee resources that are available. Sure that we had that communication plan. We also put out flyers in all of our break areas. We also talked about it during our safety committee meetings. So here at Moxion, we have about less than 50% of the entire org is involved in a safety committee. So, that's about 150 individuals. And so we trained all 150 individuals on how to apply Narcan, how to recognize, the symptoms of potential drug overdose. So I would say communication is one piece. I would say training is the second piece.
That's really helpful. Thank you for that. And I am curious, some of the things that we get a lot of questions about is that policy element, on if you should integrate it into existing emergency preparedness procedures and programs that you already have, or if you have a standalone policy or procedure. So what did you guys end up doing to really articulate all of this and put it underneath, to give it some more formal backbone, I suppose?
Yeah, so at Moxion, we do have an emergency action plan. We do have safety teams that are trained in first aid, CPR, AED. So we are actually, this week is safety week for us. And so we're actually giving a CPR class right now, and incorporated in that training is Narcan training. So we do take every opportunity to train all of our employees. By adding Narcan to our EAP, it cements it as, hey, this is a potential scenario that you might encounter in the workplace. These are the resources we have available. These are the procedures we want to follow. And then making that document readily available to all employees, as is the right as an employee, is super helpful. They see it, they recognize it, they say, wow, my employer is genuinely, they genuinely care about, whether this happens in the workplace, and, they're providing Narcan and training people on how to use it.
Awesome. It's great to hear how integrated the program is. So while it's written down and communicated, there's so many opportunities that you all are taking advantage of to really make sure that it's a cross-functional program, and it's very visible. And kind of thinking about that and some of the holistic nature of your program, you've done a lot of work with the community, and that was a piece of the video that you shared on how that was really a nice layer to being able to work with the employees and share outside perspectives from experts. So can you share a little bit more about how you worked with the community and really how you felt that was an important part of this conversation?
Yeah, I have to admit, I was rather ignorant in the beginning. I just didn't know enough information. So, using the resources through NSC, and then even just trying to find out what local resources are available. So I connected with a local nonprofit, Bay Area to us, the Contra Costa Meds Coalition. I spoke with their chairperson, and we had really great conversation on dialogue on, hey, we're local to the Bay Area. This is what our employee workforce looks like. Can you come out and maybe potentially give a talk on this topic to our employees? And they were more than happy to. They visited us actually twice on two separate occasions. She and I maintained that dialogue and conversation. It's ongoing. And, she did great. She came out on site. She gave even more Narcan training to all of our employees, which was amazing. And so we've been sort of talking back and forth over the last few months. You know, I have attended some of the workshops that they host in some of the community centers and also some of the local high schools. And so we've really been fostering that relationship and seeing how Moxie can partner with local nonprofit to help make sure that, you know, we're not just doing this in the workplace, but we're also making an impact on the communities around us.
Great. Yeah, thank you for sharing that. It's something that we feel is a really important part. There's a lot of great community partners that workplaces are always looking to take advantage of, and same with community partners looking to integrate into the workplace. So I think it's a really logical step in creating these kinds of programs to work with others in this space. So thanks for sharing your process on that. And I know we're getting a little bit tighter on time, but just I think to wrap us up here, what was some of the feedback from employees, and did that change over time? You know, it sounds like it did a little bit on some of the initial reactions versus once they got used to some of the trainings and these communications. Did that change over time, and are they excited about maybe the next iterations of the program?
Yeah, I'll tell you a quick story. So, you know, we deployed Narcan and, you know, within an hour it was gone. And I walked by, and I think actually Janice was maybe visiting that day at our location. And I turned to my technician. I said, "Did we deploy Narcan in that area? Like, I thought we did." And then the technician said, "Yeah, I deployed it like half an hour ago, and it's already picked up." So I think just the simple fact that employees know what it is, they recognized it, and they picked it up themselves is just a clear indicator that, you know, we're doing the right things. Throughout some of the training sessions that we've given, I've had several employees come up to me, like just share their personal stories about how this crisis has impacted them or someone they know, and they are immensely grateful for us, you know, taking these steps to have this type of program, make this resource available.
That's awesome to hear. Thank you so much, Jonathan, for sharing, you know, all of the different facets of your program. Really just kudos to you and your organization for making this a priority, and also for working with us to help capture the steps that you've taken. So hopefully to this group and others who will be utilizing resources to give them some steps to follow or an example to consider as we're working through creating more opioid overdose response programs in our workplaces. And we have a few minutes left, so I am going to just look at the Q&A function for both Jonathan, you, and Janice, so we can try and get some of these audience questions answered. And I will say, if we don't get to your question, you please do email our nsc.org email address. So it's respondready@nsc.org. And we'd be happy to share these responses and also share those with Jonathan if they're specific to his program. Okay, so starting here, I think, Jonathan, this one is for you. And I think you've already answered this, but just to cover bases. Sandy is asking if everyone gets to keep their dose at work or if you allow them to take it home and still also have doses within the workplace.
Yeah, so what we do is, you know, we provide Narcan in all of our first aid kits, and we also have it in break areas. And much like COVID tests, you know, we make it available to all employees. You know, there's no judgment. You know, if they grab it, you know, they can put it in their bag, they can take it home. You know, we want them to use it in case they need to. You know, if you look at it, you know, it's a relatively small cost, but it can potentially save a life, and that makes a huge impact.
Absolutely. Thank you for that. Janice, this other question's for you from Jai, asking what is the shelf life of naloxone and what is the liability of someone administering naloxone with no training, and if there's been any cases of litigation or improper use of naloxone. So a few pieces of that question.
Yeah, so I'll try. The shelf life for naloxone is 4 years. Narcan, 4 years. Shelf life now, that was just increased late last year. You know, to administer naloxone, there's directions on the carton. If you just happen to just pick up a box of Narcan, you can read how to administer it. We have talked to Emergent Biosolutions, and they have not been able to provide us any data on any adverse reaction. There have been you know, hundreds of thousands of doses of naloxone administered, and they really have not been able to give us any information on any adverse reactions. And then again, you really need to look at your state Good Samaritan laws and be familiar with what your state is covering as far as Good Samaritan on someone just trying to help to save a life in the community or at the workplace. So those would be the what I would say. I hope I covered every piece of that.
Yep, I think that's great. And then I know we're at time, this one's a quick one. Someone's asked if you have to be certified to give someone naloxone. And the answer to that is no, you do not have to be certified. You can get certificates of completion, of course, for tracking purposes, but you do not have to be certified in order to administer naloxone. There's a lot of other great questions in here. As I mentioned, we're not going to be able to get to all of these today, so please do reach out to us. And I will be sending out a follow-up email today with a lot of the links and resources shared, including the awesome video with Moxie and Power for y'all to reference and hopefully share with others to get some buy-in within your own organizations if you do not yet have a program. So thank you again to our speakers, Janice and Jonathan. It was awesome to have you here today to provide this overview, and really just shout out to everyone who attended today to make this a priority and for participating in National Safety Month. Have a great rest of your day, everyone.
Thank you. Bye-bye.